Hi guys. So today I wanted to talk to you because it's been so long. It's been forever and a day, but there are reasons for that. I have been busy with very unpleasant things, but this video is going to be a two-parter. First, I wanted to talk to you about it's like an update on how I've experienced the epidural steroid injections, and then I'll talk to you a little bit about the surgery I'm going to have tomorrow, which is a microdiscectomy. Okay, so first of all, for those of you who don't usually watch this channel, most of the videos in my channel are devoted to reusable feminine and menstrual health care. But these videos that are about my lumbar spine issues will all be clearly marked if that's what you're here looking for. In this one, okay, my back problems started when I was in my mid-20s. I didn't have an accident or an injury or anything particular that you can pinpoint. I have degenerative disc disease in my lower lumbar spine, which basically means that my discs compressed earlier in life and not due to severe morbid obesity or an injury that caused them to compress. They're just faulty in some way. And I'm lucky because so far the only part of my spine that's affected is the lower lumbar area. Okay, so in 2004, late 2004, I got my first disc herniation, which was my L5-S1, and then in summer of last year, so summer of 2015, I herniated my L4-L5, and that's the one I'm going to be operated on tomorrow. The herniation is much bigger than the first one was. So I've done everything. I've done physical therapy and physical therapy and physical therapy and auricular acupuncture and epidural steroid injections. And I'm one of the lucky people who did receive quite a bit of benefit from most of it, and especially the injections. I had my first injection, I want to say it was at the end of October, and then my second one at the very beginning of November, and then those wore off. They wore off about 2 months later, and so I got my second shot in January 6th. And it's already starting to wear off. And I talked all about my doctor's process for that and what it was like to actually get an injection in a separate video. So in this one, I'm just going to go over the side effects as quickly as I can, and then I'll talk to you about the surgery I'm going to have tomorrow. So the injections I received were the Kenalog brand, and it's an off-label use of that particular steroid concoction to give it in an epidural injection. In fact, most epidural steroid injections, from my understanding, are an off-label use. And only about 50% of the people who take them, because people are given these injections for a variety of different pathologies that cause back pain. And I'm in the category of people for whom the shots are most likely to work, and for me, they did. Only about half of the people who receive epidural steroid injections actually receive significant pain relief. I received total pain relief, and I have been so grateful because when my pain comes back, it's bad. It's debilitating, can't walk kind of pain. So it's time for the surgery. Okay, so for those of you who are contemplating steroid injections and wanted to see how those worked out for me, because I did a video after I received my first one, but couldn't really talk about long term. This is the most obvious side effect and the most long-lasting one. And you can see I'm broken out like an adolescent, which is kind of novel. I haven't had my face break out like this definitely not since high school. So this is interesting. It's not bad, it's not painful like adolescent acne. It's just ugly, and it'll go away. That's the experience I had, is that after my first two started to wear off, this started to clear up. I also have facial flushing, like my face will get really, really red, and that seems to have worn off. It's usually in the first week or two after I get an injection. My face is really, really red. And there's a video that I've done that I'll post later when I'm done with all my surgery. I did some of the video, already filmed it, and you'll see that my face is really red. And that was because I did it 2 days after I got my latest injection. And then I do have minor headaches, and I've never been a person who receives chronic headaches. I just don't have them. But since I started getting the steroid injections, I have had chronic pretty mild headaches that go away with just a couple of Tylenol. But the headaches of varying severity are a side effect that they warned me about. And then the final one is that it messed up my menstrual cycle. So I've basically had spotting daily, which is not something that most of the male people who receive these shots will have to worry about. But for all of us who are menstruating age, that's something that may happen. It certainly did to me. Okay, so let's talk about microdiscectomy, which is my procedure tomorrow. Basically, if you're going to get spine surgery, the one I'm having is the one you want to get. It's the least invasive from what I understand about it, which is very little. Again, not a doctor. Not a doctor. But anyway, so what they're going to do for a microdiscectomy is they're going to, there's your spine, the back of your spine has these little points on them. Yeah, look them up because I'm not your girl for proper names. I'm sorry. But the part of your vertebrae that sticks out and then there's on the sides, I'll be laying on my stomach, so my spine's going to look like this, and they're going to drill a little hole so that they get access to the disc space underneath the vertebrae. Does that make sense? So they're going to drill a tiny little hole so they can get access. And then they're going to take surgical tweezers and they're going to go down in there and they're going to cut and remove all of the external herniated disc material. So you have to think of your disc as like a bicycle tire. There's the outside part that's like hard, like the vulcanized rubber on the outside, and on the inside there's a softer inner tube that's squishy. That's the best analogy I've heard. I think the harder part on the outside is called the annulus, but you'll have to look it up because I'm not very good at remembering and retaining these kinds of things. One of them is the annulus. It's either the outside or the inside. I don't remember. Anyway, so when you have that outer ring, that harder part, or it's a fibrous, tough material, and if via compression or injury a hole is ripped in that, then the squishy jelly part on the inside can poke out, and then it can touch nerve roots, which is what causes all that pain, and there's a highway of nerve roots in your spine. So basically, if anything pokes out where it's not supposed to be, even a little bit, it's going to be jamming up against some nerve roots, and that's what causes all of the debilitating pain. So you got something that's the size of a garden pea, a little tiny French pea, and it can just completely shut down your whole body with pain. You can't really function. So they're going to go in and they're going to remove that little French pea-sized extrusion from my disc. And then they're going to take a little thing that looks kind of like a shepherd's crook, only it's teeny tiny, and they're going to go down there and they're going to kind of imagine this is a nerve root, and they're going to take that tool and go like this all around it and make sure that it's free, that nothing else is pressing on it, and they will assess how badly the nerve root looks while they're down in there. And that's basically what the procedure is. It's a really simple thing. Because they don't remove, they don't have to cut through muscle. They just move the muscles out of the way. They don't actually cut them. So there's no muscle tearing. There's no structural changes. They're not going to remove any bone or put in any artificial pieces. They're not going to fuse any of my vertebrae together. There will be no change of the natural anatomy. Nothing is going to be added or removed except for that one little piece of jelly that's squashed out of my L4, L5 disc. And so because of that, the recovery time should be really short. It should be a couple of weeks until I'm feeling better. The only big risk is reherniation. So for the first several weeks, the first 6 weeks after the procedure, there's a bigger risk of reherniating the disc, and that's what we have to avoid. And so there will be a lot of laying around flat on my back. They're going to give me full instructions, and I will update after I've had the procedure. I'm hoping that I feel well enough to record a little something to talk to you about how I feel on day 1 after the procedure, once I'm at home again. And I'll see what I can do about that. So maybe I'll do my first ever video from my phone. We'll see how that goes. But it is an outpatient procedure. I'll only be there for about an hour, hour and a half, and then I can come home. So that's pretty much everything I wanted to say about the microdiscectomy, and just kind of a follow-up on the steroid injections. They were a very positive experience for me. I received a tremendous amount of pain relief, and I really needed it. So for those who do experience relief from them, they're magnificent. And if they have been recommended for you, don't be afraid of them. I did a full video on what the procedure was like, every step that I could remember, everything I felt during the procedure. So you're free to watch that if you're also curious. Yeah, so I'm going to have surgery tomorrow, and it's kind of a big deal. This is only the second time I've ever had a surgical procedure, and this one is way bigger than the one I had last. It was just a laparoscopic thing. So this, I'm a little nervous about it. I mean, they're going to root around in my spine with a stick. So I'm a little nervous about it. But, you know, I'm realistic about it too. I'm very grateful. I've got a pretty easy go of it as far as spinal surgery goes. So I'll update about that as soon as I can. And I appreciate for all of my subscribers who have been waiting so patiently for me to come out with more videos. I promise you, I know I say this every time, but it's, you know, every time I think, okay, this is it. We're almost done with all this mess. But I really do think this is it. The surgical solution is always the solution of last resort. And so we are at that point. And I'm hoping that this will get rid of it once and for all, and that I will come back and we can resume as we used to on a much more regular basis. So anyway, I will see you all again soon and let you know how it went. Thanks very much. Bye.